that young people aged 15 to 24 are most likely to struggle with their mental health more than any other age group. And we're approaching this from the upstream side, from the side of prevention. So working in awareness, education, essentially helping teach young people how to take care of their own mental health. And we know that the pandemic has only exacerbated some of these issues, and that many young people report their mental health having declined over this period. And so while there have been improvements in the way that we're talking about mental health, the reality is that the problem is still there. The problem still very much exists today. And a big part of that is about stigma reduction. We know that stigma still exists in many communities across Canada. Sometimes there's stigma around particular topics. We know self-stigma is still a big issue. And so working to reduce that stigma is a key outcome of this project. So the approach of Jack Talks are essentially to take young people, to work with them, to train them on mental health, and then to put them in front of audiences to share their own mental health stories.
What I found as an Indigenous person myself, I'm Mi'kmaq from Listigish First Nation, is that a lot of mainstream westernized ways of accessing mental health supports have never worked for me. And so what the standard Jack Talk was just missing was that exploration of social determinants of mental health from an Indigenous perspective. So one of the gaps was that the actual youth speakers, we didn't have an Indigenous pool of speakers. And so the youth speakers who were non-Indigenous and who were going into these collaborative talks ended up sharing pretty candidly that they felt a lot of anxiety and they were ending up self-stigmatizing their own experiences with mental health because they were like, I don't understand what it's like to be an Indigenous youth in Canada, in this colonial system, and it feels like I'm the wrong person to be talking to them about this. And so we started to develop the Indigenous Jack Talk, the Jack Talk for Indigenous audiences. We go in and we facilitate a sharing circle because we know that traditional ways of learning are what resonate most with Indigenous youth. So when these youth come in and they're sharing their stories, there's a lot of emotion in the room, and sometimes it's a huge happy emotion to be able to have this space and to share this space, which tells me that they've not been given this in the past. To see yourself in mental health programming makes it safe for you to get involved in mental health programming.
The reason why we create Be There was because we saw a need for youth wanting to better learn how to support their friends who were struggling with their mental health and not knowing necessarily how to do that. So the first step for this program was actually understand what were the steps that youth needed in order to better do that. Jack.org came up with 5 golden rules. Say what you see, show you care, hear them out, know your role, and connect them to help. Within the Be There certificate, what you are going through, it's 5 different modules. Each of them focus on one of the 5 golden rules. And within that, you will see videos, stories, scenarios, exercises that are capturing youth experiences with each of those golden rules. The Educator Hub is a digital resource that is focused on educators and help them to take advantage of the different programs that Jack.org has available for supporting youth mental health.
And so the outcome that we're really looking to drive towards here is helping young people learn about mental health, learn about how to take care of their own mental health and others, but in a way that works for them and in a language that really resonates with them.
We are working with youth across the country who are the change makers. They're saying, like, no more are we comfortable just surviving. We are meant to thrive. Sovereignty over wellness and wellness practices, that's what this project contributes to.